Welcome for you in this course, Type 2 Diabetes Tail and Pharmacology, Multilevel Intervention. Congratulations for having this chance, and all I can say that I'm really so proud to meet you in this course. My name is Madam Abdul Nasser Tashtaya. I am a Palestinian pharmacist and American Studies instructor who is teaching on Udemy. However, the occurrence of kind 2 diabetes mellitus is growing worldwide. Type 2 diabetes often results from advanced failure of pancreatic beta cell rule in the attendance of chronic insulin impedance. Multilevel intervention survey catches the promise of more precisely symbolizing real-life conditions than single-level intervention survey, and hence, with the proper survey measures and design, being more likely to assist the efficient and effective resolution of complicated healthcare framework issues. The aim of this course, a key notion in multilevel measurement approach, is that theories, measures, and constructs must be harmonious. The introduction of interference at multiple standards demands that the standard of measurement, standard of theory, and level or kind of statistical precision be harmonious. The aim of this course is to appear the significance of multi-level type 2 diabetes intervention approach, to propose how changes in this tactic may encourage the public's health, to determine measurement opportunities in the scope, and to sketch upon other scopes to supply direction concerning essential measures to multi-level type 2 diabetes patronage intervention researchers. Significance of the course. Practitioners and researchers wishing to place multiple interventions at various standards of impact face two present requests. Which collection of interventions are people to manufacture complementary or synergistic impacts? Why? Policy manufacturing bodies and funding firms offered with competing suggestions for multilevel interventions meet these requests as well. The causal modeling technique that I utilized in this course presents a common framework for reasoning via the logic of multilevel intervention sketch. Method of this course. For multilevel interventions, anyway, it is not enough to measure impacts at the various standards of interventions. For example, healthcare, team, and patient. Cross-level impacts must also be picked into consideration. For example, the impact of the healthcare team on the patients and patients on the healthcare team. My course must call three persistent barriers to develop in multilevel interventions addressing health patronage delivery. A. Demonstrating interventions between the standards practically and theoretically. B. Measuring the contextual impacts and interactions in quantifiable tracks that construct theory and participate to more powerful interventions cover time. And as well, C. Improving the course infrastructure and training chances for multi-level intervention inspectors. Results and conclusion in this course. In intervention survey, the matter of mediation interests how a specific intervention manufactures a desired result. Some people propose, for instance, that audit and feedback interferences impact physician behavior by inducing self-directed simulation to decrease discrepancies between real and desired accomplishment. Although the genetic foundation of kind 2 diabetes disease has yet to be recognized, there is powerful proof that such modifiable risk agents as physical inactivity and obesity are the prime non-genetic determinants of the ailment. However, obesity is the prime non-risk agent for diabetes. Several anti-diabetic medicines with various procedures of action are now obtainable to treat kind 2 diabetes mellitus, containing sulfonylureas, thiazolidinediones, quininides, alpha-glucosidase inhibitors, and biguanides. Realization of the time required for alterations to permeate such or each level's members' behavior and awareness is oftentimes underappreciated. For instance, several multi-level interventions depend on champions, which demands training or teaching of the champion and thereafter their constituents or peers, either by the project team or champion via formal or informal public networks. Who this course is for? It is appropriate for people from all over the world who have an interest in the following approaches: clinical pharmacology, diabetes research and clinical practice, principles of organization behavior, health education and behavior, health promotion, nutrition, human learning, endocrinology and metabolism, medical sciences, clinical pharmacokinetics, autoimmunity, clinical chemistry, clinical therapy, biochemistry, pathology, laboratory sciences, epidemiology, etiology, social science and medicine, pharmacotherapy, and quality management in healthcare. And this course contains 83 resources. All I can say, many thanks for your attention, and I'd like to invite you to enroll in this course or try the free preview if you want to explore further.